Right, I'm going to stop screen sharing, Christine, because my slides have stopped working again. The joys of online events. So what my next slide was about was the polls, and I can just tell you that. So, except what we'll have to do is sorry, I'm just thinking on my feet, because we were going to put all of the polls in chat. So in the chat function now, there should be a pre-evaluation poll. So if you can see the chat, can you please fill it in? What I'll ask Marie to do is to email all of you, and she'll BCC you in, so that we're complying with GDPR. She'll email you the pre-evaluation poll if you can fill it in, and in fact we'll put all of the polls in one email so that you're not having to get loads of emails in your inbox. Lorraine has got 2 polls for you, so in the email will be Marie's links to those polls, and they'll just open up into a browser and you can do them then, and we will get the answers. Our original invitation to you with the agenda, we indicated that the final evaluation for this event would be in a kind of plenary right at the end. But because we thought that was when we were in GoTo training, and that was the only way that we can do it. Now that we're in Teams, we can do it in the workshop. So we won't be asking you to come back to this plenary at the end of your workshop, but just to fill in the evaluation at the end of your second workshop. And finally, from me, before I hand over to Christine, is just to let you know that we've just been aware from the DMO and DCO forum and the Health Commissioner forum how much people have valued that kind of instant sharing at the moment. So we have got agreement from the Department for Education to set up a Send Leads forum, because we didn't have one. And if you would like to join it, then please let Marie know. And that's it from me, and I'm handing over to Christine.
Okay, thank you very much, Amanda. And welcome to you all. It's a strange way of chairing a conference, but I'm going to do my best. Thank you for all of you who are struggling with the technology. Thank you for all of you who've come. And I think one of the things that's really impressed me about today's conference is just the sheer variety of people that we have on the call. So loads of you from local authorities around the country, lots of you with health CCG addresses, some of you who are parents, some of you from the world of education, so welcome. For those of you who are parents, we did look at running a workshop on working with local parent carer forums against the COVID-19 backdrop. But we weren't at that stage able to incorporate it into the programme. And so what we've done, and what we will send to everyone today, is a really useful resource that Contact have produced, which talks about the challenges for parent carer forums within the midst of the pandemic and how to support them. So you will get that. I don't know about you lot, but every time I hear these conversations about how people aren't working out what to do with lockdown, and they've taken up baking bread or sitting in the sun or learning the guitar or whatever, that has not been our experience to date. Like you, we have been really, really busy trying to untangle, trying to understand what's going on and trying to make sense of it. We work closely with colleagues in government who we love dearly, but I have never seen so much guidance come out in so short of time that's led to so much confusion. And so part of what we've been doing is working to understand what's happening with you, and to work with government to understand what's happening and the links between what we're doing. And I think one of the things I want to say is thank you. You lot are under so much pressure, and yet when people like CDC come calling, you are supportive, you answer our requests, however stupid they sound at the time. And part of what we've been doing as part of that is we have been looking at the innovative work that you've managed together. You know, in the midst of all the gloom and the horror of the pandemic, one of the things that shone out for us is just how some of the innovation work's coming through. And actually, one of the things that shone out is things that we think would have probably taken 2 years to get agreement before seem to have been agreed in 3 weeks. So that's been fab. And this workshop really this afternoon gives you a chance to contribute to that, hear from other people, understand what's going on, etc. And we're delighted to be able to offer 12 workshops with you this afternoon. Thank you in advance to everyone who is speaking or running a workshop. Amanda talked about the Send Lead workshops, and just to remind you, we run a forum for designated medical and clinical officers that's really, really popular, and one for health commissioners. And this forum came along from SEN leads wanting to join one of their own. It does not replace the very, very valuable regional coordinator work or the work of the SEN advisor team. It will come together and complement that. It's far more an opportunity for you to be able to say, has anybody got out? We're doing a piece of work here. Have you done this before? Does anybody understand what this means, etc.? We very much at CDC believe that you're the experts and we let you work out that expertise. But also what we do is we monitor it with our colleagues so that if there's obviously something missing or an idea we've found that might be useful or whatever, then we can share it with you. So it links very much with the Leeds Forum mentioned. I think Tracy wants us to chase the name Tracy, so we'll have a look at that. But having spent 35 years trying to work out a different name for key workers and not solving them so far, naming things isn't one of my specialities. So yeah, let's try and pull this together and do that. And tell us how it's working for you. Okay. What we've got today is a combination really of national speakers who've given up the time and have come and join us today to give you a sort of picture of what today's like. Remember that today is different from yesterday and tomorrow may well be different again, but at least we will know what today brings us. So I'm going to introduce you to Andre Imich from the DFE in a minute, followed by Lorraine Mulroney, who's the Senior Nurse at NHS England and Improvement, and followed by Richard Owen, who's the Head of Children at NHSE. And then we're going to look at it from an inspector perspective, working with Ofsted and CQC. So you get a really rich array of the people who are trying to make this challenging national picture come together. And after that, we'll go into workshops and we'll tell you a bit more about those as we go along. But if you have not got Teams links to your 2 workshops that you are in this afternoon, and you don't know what they are, or you've forgotten them or whatever, please will you email the wonderful Marie mhunt@ncp.org.uk, and Marie will make sure that you get those links in time. One of the things we would ask is, while it's wonderful to look at faces, even though at any one time on this screen I can only see 9 of you, it will be really helpful if you're not speaking to switch your camera off. You'll still hear the conversation. All it does is it preserves the bandwidth that we've got. And we are expecting up to 200 people on this call. So we are trying to make sure that we will hold the integrity of the connection throughout. So if you could do that, that would be great. We're going to keep an eye on the chat. I know that some of you are struggling to use it. Keep an eye on it. And I will try and keep an eye on anybody who's got their hand up. But as Amanda said, that is rather challenging when I can now only see 6 faces. But the other thing to remember is what Amanda introduced. We have no chance, really, with an audience this size, of answering all of your questions today. But either put them on the chat and you'll get it in the feedback sessions, or send Marie an email with your question, if email's the easiest thing for you, and we will pick them up once this session finishes. Okay, so without further ado, because we are also going to run to time, I'm going to hand you over to Andre. Andre, most of you should know, he's the SEN Disability Professional Advisor at the DFE and the man who knows what there is to know. Andre, welcome, and over to you.
Right, thank you, Christine. Can I just check that you can hear me? There seems to be a bit of echo back. Is that okay?
No. Yeah, we can hear you, Andre.
Okay, and you can see my slides.
We can see your slides, yeah.
Right, well, all systems go, and thank you, Christine and Amanda, for inviting me to do this and drag me away from contributing to more guidance. So That's a pleasure to be here. So I want to speak for about 15 to 20 minutes, and then I think there's going to be a few minutes for questions, which I think will come through the chat line. And I just want to, again, bring people up to speed as best we can in relation to the return to school. I want to mention one or two other things. I want to mention the national trial update, but talk about schools and colleges and the wider opening and our latest thinking and guidance. Risk assessments, and then update on the temporary statutory changes. So Jen, briefly, just to point out what hopefully all of you have picked up, but we have issued information that the extended rights trial, the redress, has been extended until at least the 31st of August 2021. So that was a ministerial decision, and a letter went out a few days ago about that. We're also restarting the evaluation of the trial to inform the final decision about whether this should become part of the statutory framework. And the Minister expects to make an announcement by early spring about the permanency or otherwise of the extended rights trial, of the extended rights process. So that's just starting off with a bit of wider information that affects, I think, everyone on this in this seminar today. But I did want to try and draw on one or two aspects of research about the way that families have been finding the current situation. And the Disabled Children's Partnership last week presented to us a survey that they'd carried out of over 4,000 parents and carers in the last few weeks in lockdown. And I've only just got this one sort of slide from a number of very important findings that they had. But essentially, they were finding that of these parents and carers in lockdown, a significant number were affected, particularly in relation to emotional and mental health, more so than in terms of their general health. And you can see that 71% of parents said that their disabled children's emotional and mental health had deteriorated during lockdown, and that the child's general health had also deteriorated, not to such a great extent, but nevertheless 45% of parents were concerned about that. Also, a significant number of parents and carers were saying that their own emotional and mental health has deteriorated during this time. It may not be that surprising, but we all need to be very conscious of that and ready to support as we move forward. 83% said that the lockdown was having a negative impact on their children's friendship groups and on their learning and communication. Again, probably not surprising, but it's important to have it quite explicitly stated there and for us to pay attention to that. And also a survey, some research by the University of York looked at parental perspectives on support during lockdown. And I think that's quite hard to access from a local authority and CCG perspective, the actual feeling on the ground about the support. But quite a number of parents and carers felt that the support they'd been getting was, well, 37% said that their support was extremely or somewhat inadequate. 40%, however, did feel that it was somewhat adequate. So a mixed distribution, almost a normal distribution there. But there are some who are saying it's been extremely inadequate, but also a number saying it's been extremely adequate. So a fairly normal distribution, but nevertheless, something for us to pay attention to in terms of the support we've been providing. And then just turning quickly to our messaging about the return to school, which I know seems to sort of change quite frequently, but we are very clear that all education settings are open to priority groups. That includes those with education, health and care plans, and that since the 1st of June, primary schools are welcoming back those in nursery, reception, year 1 and year 6. And since the 15th of June last week, secondary schools and others are offering some face-to-face support. So, and the numbers appear to be increasing. We're also giving a very strong message to our special schools sector that they should be welcoming back more and more children. And all in all, it's really very important that risk assessments for children with plans are kept up to date. These inform whether the child should be in a setting or not, and if they're done well, they will also inform the sort of support they should be getting, whether they go back to school or whether they remain at home. In relation to our specialist providers, special schools, etc., the aim is to ensure that more and more children attend on-site provision. Obviously, that's got to be balanced with the safety of children and staff. So we're saying the special schools, specialist post-16 sector should be working towards a phased return of more children, that unlike the mainstream sector, the focus is not on specific year groups, but that risk assessments underpin decisions here. And priority returners in the specialist provision area are those children attending who are approaching key transition points. They're about to move to another school, move to a college, move on to work and so on. And those who most need on-site provision to support life chances and development. In particular, those who need access to specialist therapies, which certainly can't be provided at home. And we know that there are challenges in providing it on site at the moment anyway, but there's certainly a group who should be prioritised. And more evidence coming from surveys that suggests that more and more families are finding it increasingly difficult to keep that level of care and support that their children need. So those are priority groups. Clearly, those children at the moment who are considered clinically extremely vulnerable and who should be shielding should continue to do so and not be expected to attend. Clearly, there were announcements about that yesterday, and the detail of that will appear in the very near future. But nevertheless, today, until the end of August, that's our message about shielded groups and schooling. So going back to specialist settings, clearly, as I've said, year group is not the important factor, is not the decision maker. We are encouraging schools to use part-time tables, attendance rotas, blended on-site and home learning, etc. So a variety of packages and approaches are permissible within the specialist sector. Ultimately, we want more and more children to have access to the school environment. The purpose of risk assessments really is to provide information about where children should be supported. I think I've covered that, so I will move on. These slides will be provided to you as soon as this finishes. And at the bottom of the slide, I've included the name of the guidance from which the slide is based. Factors to take into account when doing risk assessments. Obviously, the level of challenge that families are facing in terms of care and support. The reduction, sometimes the complete absence, it seems, in one or two areas of respite and short breaks is a very powerful indicator of the need of a child to go back to school where possible. The loss of care from extended family, clearly isolation, lockdown has meant that families have not been receiving the level of attention and support and visiting from extended family and indeed from neighbours. So what are our messages about attendance of children with EHC plans? Well, basically, attendance is expected for those with an education, health and care plan following a risk assessment. So where a risk assessment says you should be going to school and you've got an EHC plan, you should be going to school. And regardless of the year group, that is a truism. It does mean that children who are now offered a place by their education setting should be attending. However, we do still recognise that there's a degree, and this varies across the country, of confidence amongst parents about the return to school. So there are a number of parents who are very anxious about that at the moment. And certainly at the moment, we're continuing with the position that parents will not be penalised if they choose not to send their child to school. So a very clear message that we expect children with education, health and care plans to be at school. And that's something we need to keep on reinforcing across the school and college sector. Again, messaging about PPE, again from the safe working guidance. PPE to be used, well, for those who have complex medical needs, tracheostomy care, for example, and those who require intimate care needs. But we are expecting settings and providers to use their own supply chains and to approach their local resilience forum where that's not possible. There is some guidance about children who can't adhere to strict hygiene practices. And of course, in many special schools, there will be a number of children like that. But remember, they are not, they are at school because it's regarded as safe for them to be there. And we have to be realistic and recognise that it is impossible to provide the care that some of these children need without some close hands-on contact. So we have to reinforce the need for the basics to be in place. Hand washing, close contact, clean surfaces, regular cleaning, and so on. But we have to be realistic about the challenge here. There are children who spit uncontrollably, who need quite a lot of hands-on contact. But if they're safe to be in school, we should be supporting through strict hygiene practices. I know it's not an easy message to convey at times. We updated a message in this guidance on supporting the return around an issue that we've heard of in some places. We have heard that some schools might be saying to families that they require medical evidence that the child can go back to school. We have made it clear in amended guidance earlier this week that educational settings should not seek medical advice, except to help them support the child or young person more generally, so where they would normally do that. Educational settings should not take the clinical vulnerability of a child as a reason for refusing a place to a child or a young person if they would otherwise have readmitted them. We felt it was very important to come out with that message, and I suspect there are a number of you listening who will want to record that, and you may need to point that out to any settings. So please do let us know if that is a major issue. Quick word about the two temporary changes to legislation. The Section 42 relaxation of the duty to a reasonable endeavours duty to provide health and social care provision, that remains in place. It's a monthly position, so the Secretary of State has to renew that every month. So we're almost at the end of June and the Secretary of State is considering that actively as we speak. The timescale relaxation, where something can't be done because of a reason relating to coronavirus, is in place until the 25th of September. It's interesting because in our more recent conversations with local areas, a number are finding that they're not having to turn to that. I think that from the early days of lockdown, we've now seen greater stability amongst services. A number of health practitioners in particular who were redeployed have come back into their role with SEN. So that we don't get the sense that that's being hugely used at the moment, but that situation is, I think, rather sort of delicate. So it's still there until the 25th of September. We do say in terms of reasonable endeavours, it is really important to keep a record of provision that you're making, to confirm to parents what you're doing and to keep that under review. Some basic elements. It's not meant to be creating a monstrous bureaucratic task. It's meant to be done relatively manageably, but it will only be done successfully where I think local authorities, CCGs, working together with providers to ensure that it's done in a proportionate way. The implications of the temporary changes, well, none of it is a blanket change. It's all down to individual cases, and we need to make sure that any issue about reasonable endeavours or relaxation of timescales is considered in relation to the individual case itself. We've published a number of online resources, so I've put them there so that when you get the slides, you can see them. The Oak National Academy has got some specialist areas. I'll show you those in a second. NDCS, one of many excellent organisations that has produced some targeted home learning materials, and DFE has recommended some. For those of you who haven't seen the special needs section of the Oak Academy, National Academy, I thought you might be interested in what it's offering. And I can't click on any of those, but I think some of you in the seminar might be interested to click on one or two of those and see what is being put forward there. So worth having a quick look if you haven't done so, because these are certainly being very strongly promoted by the department and by many schools. So worth having a look at what's on offer in relation to speech and language therapy or occupational therapy, for example. Some key guidance, some key documents, so just keeping you up to date with publications will be in this slideshow. And final tips, do read the various guidance documents. They are written for a purpose. Really important to keep staff updated. I know it's difficult. I find it difficult to keep myself updated, let alone tell anyone else. Keep information up to date on the local offer. Every day I'm looking at some local offers for a variety of reasons. Some of them are superb, some of them are a bit scant still. I do think it's really important to work together on that, particularly with parent carer forums. Avoiding blanket policies, etc. Working in partnership with schools and colleges and using SENCO networks, really very important. There's some really exciting examples of how SENCO networks have been used. And some local areas seem to be having forums like this once a week with their SENCO networks. We're getting close to September. Obviously, lots in the air and lots of anxiety about September, but particularly for those who are starting in a new school. And again, that message about keep creating solutions. We're not through this yet. There's been an enormous number of amazing solutions. Keep it going. I'm going to try and join you, and Amanda or Christine will help me through any questions that may or may not have come in. Right, I think I'm back with you, am I?
You are, Andre, but Christine's muted herself.
All right, I thought I'd frozen for a minute. Okay, I'm back.
No.
So.
I don't know how many of these things I've done, but I mute and forget to mute myself at least once in all of them. But I'm here now. What's interesting, Andre, is what is coming through the chat really. It's still confusion. So people really needing clarity. So I think three things have really struck me. One, on that issue of risk. So some schools assuming that children, young people carry the same risk as transmission of adults. So not welcoming children back in the same way. Some confusions about PPE policy. I'm not sure I was an expert on aerosol generating procedures 15 weeks ago, but I know a lot about them now. So some stuff on PPE and aerosol generating procedures. And the other thing, which is sort of slightly separate, Andre, and you may not be in a position to answer, we've tried to do something as the chat's gone on, is whether or not we should be expecting any further guidance about what might or might not be happening in the school summer holidays.
Right. I'm not quite sure how we will be approaching that, whether it will be amendments to existing guidance, which is where we want to try and get to at the moment. The guidance with that question about shielding, for example, had 2 or 3 other small amendments, but we wanted to build it into existing guidance. So there will be more about summer holidays, but I'm not quite sure what the format will be for that. Okay,
and in terms of the sort of frustration levels from people about how do I find the most accurate guidance and the most up-to-date one that reflects my current position, whatever position people are in the system. What's your advice for how to do that? I mean, at CDC, we're very much trying to help people do that. But if you've got any other tips, Andre, they'd be most appreciated.
Yes, I mean, there is a web link for all updated documents and publications from the DFE. It's there every single day. Maybe I should post it to you so you could actually look at that.
That'd be helpful.
It's probably the only way to keep up to date with everything that's coming out, but there's so much there that you won't want to look at every bit of it. But it certainly keeps you up to date. I mean, like yesterday, there were probably about 7 items. That includes updated items, but there's certainly a DFE link for that. I'll post it on this chat after I've finished speaking. So that's worth having.
Okay. That's really helpful. I know I can see.
And again, we do try to, the key ones for SEN, we do try to disseminate through CDC, the regional coordinators, as soon as we can. I mean, the redress, which isn't COVID related, we got out immediately we could. So we are trying to highlight the ones that are definitely very SEN focused. We're trying to get out as quickly as we can.
That's really helpful, Andre. One of the things I'd say to people is we've worked with the DFE for a long time, and I know that DFE officials have been working 18 hours a day, 7 days a week on this, and are still struggling to keep up with the level of change and the level of the level of movement in the process. I know that because about when they decide they want to talk to me. I think 2 questions on here. One I think is relatively easy, Andre, so I'll give it you, which is about Section 42 of the Children and Families Act. When will it be extended again, or will it be, and when will this be announced? And we have a straight timetable.
Yeah, Section 42 is only in place for a month, a calendar month at a time. So at the moment it ends next week, next Thursday, I think, is it, or next Tuesday, or whatever day it is today. But you will hear about it in plenty of time, which is probably about 24 hours before the end of June, whether it will be extended or not.
Okay, and we know that in terms of the Coronavirus Act, Andre, that the final extension currently laid down in the law doesn't take us beyond September the 25th, don't we?
No, that's only for the other temporary legislative changes, the timescales.
Right.
The government's Coronavirus Act was laid down for 2 years. So yes, theoretically, Section 42 could go on for 2 years. But it is a month-by-month decision, and it's very, very carefully reflected upon, I assure you. Sally Orr, I'm interested in your comment about voluntary organisations using school premises. I mean, it is quite interesting because there's quite a number of special schools that actually do normally allow their premises to be used either by themselves or by others, including voluntary organisations during summer anyway. So, we'd want to encourage that normality where possible. But there will be more information about the summer breaks.
I think the confusion, Andre, is whether or not schools will be required to do anything over the summer holidays. I'm not sure that people are clear about that. So, of course, if schools are open themselves, then the voluntary agencies that normally use them for short breaks will not be using them because the school would be open. So, and I'm going to stop it now. I know there's loads of questions on here, and I can see it, and I can see your frustrations, folks, about timing and guidance and summer and whatever. And we will try and come back and answer those questions. We will capture the chat, and where there are answers we can give, we will give them. So thank you very much for Andre. 2 things from me before we move on. One, can those of you who've got your cameras on, can you switch them off, please? It's not that we don't want to see you, it's just we're trying to preserve the internet. So if you have a camera on and you're not speaking, can you switch your camera off? Secondly, and I'll do this one, a number of you have asked about the SEND review. So as Director of the Council for Disabled Children, I can tell you that I sit on the National SEND Leadership Board. We met last week for the first time since the pandemic. We are absolutely clear that ministers are passionate about the SEND review resuming, and that they are also going to take into account the learning, both the challenge in learning and the positive learning that has come out of the pandemic. they are currently, so we are currently looking for an announcement of the next phase of the review. Part of that is the tie-in with multi-agency colleagues. So some of it is about ensuring that our colleagues in health have a bit more space in their head to think about these things, because at the moment, of course, they have been totally consumed, not surprisingly, by the pandemic emergency. So the SEND review has not gone away. Government is still committed to it, and as soon as we get further information, it will come out to you. And finally, and we will pick up the chat, we will try and do clarification, but I cannot stop the government issuing guidance at 7 o'clock on a Friday night. I wish I could, and neither can Andre. The last thing is that the short break stuff, we know is confusing. We are doing some work with government at the moment on looking at innovative provision and looking at the currently conflicting guidance that's stopping provision moving. So we're doing some work on that, and there is a short break workshop or two in your workshop list for later. Okay, so thank you very much, Andre. It's really appreciated. I know how busy you are. Right, we are now going to move on to Lorraine. It's a real pleasure to introduce Lorraine Mulroney, who is the Senior SEND Workstream Lead at NHS England and Improvement. If you haven't worked with Lorraine before, you are in for a pleasure. She's an absolute powerhouse of a person who just continues to drive change forward and make things happen, and we're really, really grateful for that. Lorraine will be running a number of polls that you will see in the chat box. As we said before, if you cannot access chat, these will come to you through the email system. Okay, but without further ado, I am going to introduce Lorraine. Welcome, Lorraine, and thank you for joining us.
Thank you, Christine. You always call me a powerhouse. Gosh.
It's true.
Am I sharing my own slides?
Marie should have them. If not, I've got them. Marie, are you about to share your screen?
Yeah, I will now.
Marie is wonderfully doing about 9 things at once.
I know.
Yeah.
While Marie's doing that, welcome everyone, and good afternoon. It's fantastic to see some of you and know that you're listening to us, and we've got this opportunity to have a really good talk about what's bothering us, what's good about how we've managed during this crisis, and where we're going, and some positive messages, because my next slide is probably my most important slide. So Marie, if you could move on to that, please. It's really that personal thank you, and I did the same at the DCO and the DMO meeting a few weeks ago, and it's from me to you, because I know what you've already been doing, because I've spoken to many of you over this time. I know what you're currently dealing with throughout the different regions, because I'm joining you in those conversations, and I know that you are all passionate and real strong leaders, and you want to continue to be that champion for children and young people, and you will continue to make sure that children in your localities are at the forefront of any decision making. So it's a personal thank you from me to you. Next slide. And this slide is just a really reminder. Colleagues who work with us in CCGs, and some colleagues who work in local authority, are often asking me who's working on SEND across the different regions. We have 7 regions now in NHS England, and you've got the names in the green boxes of who works in SEND. And all these colleagues work in the nursing directorates, but they work across many different programmes. So some work across safeguarding, learning disability and or autism, many other things. But I'd like to say thank you really to the regional leads. They have worked really hard and continue to work really hard, working along with the DFE advisors and many of their colleagues in region to really build the profile of children and young people with SEND. So I'd like to say thank you to them, and I talk to them on a weekly basis and sometimes even more. So they are there to support you. If you want an introduction, you haven't met them before, if you use the email addresses above, I will introduce you. Thank you. Next slide.
Mm.
This is a bit of a reflection slide, because I'll always like to look back, because I like a positive message of where we've come. And when we had our last event for Children's Commissioners, for Health Commissioners on the 17th of March, it really was our first chance to run a conference online. It was very scary at the time, but hey ho, we're all here now and we're experts at it. So we've learned with that journey in technology, and it really was a successful event. Some of the actions that we agreed from that event is that we would link up some of our messaging to make sure that we weren't only just communicating with the DCO and DMO forum, although all the DCOs and DMOs are fantastic. We needed to make sure that we were cross-working across the different forums, because there are some members who are members of both, and messages weren't getting out in the same way. So I think we've got an opportunity to improve that now, because linked to today's announcement, which is fantastic news, and it was one of our goals many months ago, on how do we strengthen not only bringing the health commissioners together, but bringing our local authority colleagues alongside and having a forum collectively. That is what we want to model, and that's what we should be doing. So I'm delighted with that news today. Moving forward in terms of the cross-government SEND review, we also talked about how can we keep things like the issues that we were dealing with before around how do we improve special school nursing offer, how do we work on that across government, how do we continue with the SEND review, and also one of our other hot topic areas is how do we improve continuing care for children and young people. During the COVID crisis, we did set up another forum through CDC, and thank you, Amanda and Marie, for doing that. It's been very helpful, especially around packages of care and PPE conversations. That has been a helpful forum. We have also considered thinking about how we set up a forum for children's community nurses, because that is a profession led that is not able to communicate with each other on a national basis. So more and more forums to come, but I'm entirely grateful of that. So how do we get SEND on the agenda? And we discussed that a lot at the Commissioners' event, especially at an integrated care or a STP level. And how do we even raise children and young people's profile in general? Well, I have to say, we have met that, and I know it looks like it's amber there, but it's bright green, because we have been working so hard. And I've just heard from some of my regional leads today that even in the ICSs, they are talking about children and young people's SEND, and that the profile of children is getting up there. We're not there yet, but we're all working on it, and working with Richard's team, who you'll hear from a bit later. I think we've all got that flag to fly for children and young people. Next slide. So this is the poll, and unfortunately I can't see the chat, but so you heard the instructions earlier, and I'm keen to do this because this is building on when we talked to the DCOs and DMOs in their May event. We asked them about redeployment across the children's health workforce. What did it look like? How many, what type of professions were in redeployment, whether they'd gone there fully, partially, or were in discussion about going next week. And what we saw during that process is that it was therapies that was our highest concern. And this is the April and sort of May position of people feeding back on the chat. It's not full representation, but it gives you an indication of where things were challenging during that time. So today I really would like to focus on the health commissioning and the SEND team's perspective. And local authority colleagues, don't feel you have to. I'm really interested in the health commissioning side, but also if you want to participate, that's absolutely fine. I'm looking to see if, how was commissioning affected? Were children's commissioners, where they had to go on and help with other things, with COVID cells, with response to the emergency prepared teams, or were they unaffected, or just in general, what was the workforce like? Were a lot of staff off sick? Do they have vacancies? Were they shielding, etc.? It would be useful to know. So I'm going to have to ask Amanda on what we do with this if you've got the chat going.
So Marie will be emailing everybody the link to the poll as well. So if worst case scenario, and they'll send it, they can complete the poll after today's event, Lorraine. So we should be able to get that feedback.
That's absolutely great. So if you don't do it now, please do it for us, because it's part of our evidence and our thinking and how we understand. I've obviously got my own intelligence from my regional leads, but this is an opportunity for you to share your thoughts as well. If I move on then, because that might help with timing and other things, to the next slide. So what's my 3 key messages? We talked a lot about guidance on the previous discussion with Andre, and I'm with Andre. I can't keep up to date myself, but the way I do it is I go on that link at DFE and I go on the link at PHE and Department of Health and Social Care. In fact, I find a lot of stuff on Twitter and I tend to share it with the regional leads using Teams. It's a fantastic way of just being able to pop the link in, and then I make sure that anything that's important that we put it through onto the forum. And that's why I think it's really, really important to make sure that if you're not a member of the CDC forums, that you become a member, because it's instant, it's in your inbox, you can look at it when you need to, but you can also build friendships, build relationships and support each other as well. And I think that goes for not only a sort of national level forum, but it goes for our regional SEND groups as well. And I've been joining many of the regional groups, which has been fantastic, and they are led through the regional coordinator teams. My message around sort of policy and my lesson, I guess, and I'm sharing this with you, it may not be your perception or feeling, but I've really understood that no national guidance will answer every local query you have. It's impossible, because every system is different. Every family is unique. Every child has their own needs. You will never be able to answer that. But I think what's really important, if we are picking up that there are concerns in many areas, like Andre said, we need to know about it. And how you escalate those questions and queries is really, really important. So if you've got those concerns at a local level and you're unable to resolve them, working through our regional SEND leads, and then it comes up to me nationally, and then we can share out whichever government department or whichever team is working on that, because it is important. And we have seen, like examples that Andre mentioned earlier around how we had heard around some schools asking for medical advice, and that has come, and it's now in the guidance a few days ago. And of course things do take time, and please just be patient with us. It's a very difficult situation, but remember, and what I've seen more often, local policies and the things that you have made locally in terms of your decision making based on good evidence, working with your families in co-production, you have probably got a lot of the answers. It's just sometimes you need a steer and a bit of support and make sure you're going in the right direction. So my last message there is just that continue with that strong and collaborative leadership at all levels, right up from sort of school level into, for us, even in government up to national level. I've seen a stronger relationship across all the children's programmes within NHS England. I've seen more stronger relationships form between DH teams, because they have 3 different teams that work on children's stuff, and DFE. We've all been working a lot more closely. And like I said earlier, we're all champions for children and young people. So we have to continue with that. Next message. Next slide, sorry. Now, this is where I have to say thank you to Siobhan Weber. And I know Siobhan's on the call, DCO from Cambridgeshire and Peterborough. Now, Siobhan was fantastic, really, and she volunteered to speak at the East of England Regional Network about the restoration framework for community services for children and young people that was finally published on my birthday as a nice little present for me. So Siobhan, I'm using your slides, and I know we've checked that out, but I really think that we could be sharing these slides a bit wider, because I don't know about everyone else, but when you look at a formal government document, sometimes you can't see the wood for the trees, and you need to pick out the key messages and the key things that you need to help people to understand. And so this guidance that was published on the 3rd of June, it was a version 3. But what was different about this version 3, which was fantastic, is it was purely just for children and young people, because previously it was in guidance that was children, young people and adults. I worked really hard with many teams across the NHS England on this. I worked with local systems to check out that it was right when it was going to land. Of course, there will always be more questions from it. Like I say, doesn't tell you timelines, there are some caveats in there, but we are, like Christine says, we are where we are today and we're learning each day. And you know, Siobhan, I was particularly struck by your bullet point saying that the SEND had been woven through all of the different 24 lines of rows, and I think that was my key goal. So I'm glad that people have seen that at the other end. Next slide.
You've got 2 minutes, Lorraine.
Okay, well, I won't dwell on this one because it's basically telling you what you already know if you've read the guidance. But the important thing is working with the DCO and DMO during this process is absolutely crucial. So that's one of my messages, and joining it up with the risk assessment process for individual children. Next slide. I've probably said these things before, but I think as we move forward into restoration, recovery, restore, whatever you're calling it locally, we need to work together to support each other, because it will be a difficult time. We'll have learned things that are really good, but it won't work for all. We'll have learned things that we would want to let go because we feel that's appropriate. We'll have learned that there are things, like Christine said, that we wanted to do and it was going to take years, that was happening in weeks. So this is my next poll on the next slide, which we may have to do at a later date, but we did this with the DCOs and DMOs, and they were telling us that they want to amplify that virtual meetings, which we're doing today, partnership working, more of technology. Someone said weekend work. That's an interesting one. But they weren't letting go of very much. Some face-to-face meetings, but I think that's really important to understand that, because they are driving a lot of what is needed. So I think that was an important message. Restarting some of the work and projects and work streams. People are eager to get going now on things, but you've just got to be a little bit patient, because although you want to get going, other people may not be ready. So I think the next slide is just my example to do a poll, and then I have some question time, Christine.
Thank you very much, Lorraine. And yeah, we will make sure we can send the polls to vouchers, so it will come to you. And please do. It's been, as Lorraine says, the more we've co-produced the solutions to some of these challenges, and the more we've understood what's working and what isn't, then the better we deliver the outcomes that children and families need. I'm not actually going to. Are you going to be with us for a bit longer, Lorraine?
Oh, I'm here right to the end.
Perfect. So what I'm going to do is I'm actually going to go on to Richard, and I'm going to introduce Richard in a minute. Just a reminder of the rules again. We had a lovely backdrop to Lorraine's side, which sounded like somebody making a cup of tea, which was very nice, but please, can you continue to mute your microphones, because otherwise we can hear everything. And for those of you who've been caught out once or twice in Teams meetings shouting at your nearest and dearest, you'll know what I mean. So if you can go on mute, I'd be really grateful. So I think what we'll do is we are very, very pleased to welcome Richard. Richard Owen is the head of Children and Young People, a transformation programme at NHS England. Richard, I'm going to go to you, and then if we've got health related questions at the end of this, I might come back to both of you. Yeah. So welcome, Richard.
Very, very good idea, and apologies if there's any background noise my end. It's because my children seem to have arrived home from somewhere, so it might be all sorts of noise in a minute behind me, but I'm sure I can cope with that. So thanks so much for inviting me to come today. It's been great to have so many people on the call, and it's really impressive. I guess there's been a few thank yous, but I guess a thank you from me, I guess, is I'm sure what I found helpful over the last few months, which of course have been very challenging for everyone, has been I guess some of the insights that have been fed through, normally fed through from Christine, Amanda, Lorraine and I talk most weeks now. So I think that is what helps us do our job when we're trying to sort of make those connections and make that influence in all of our different organisations. So having that fed into me and to others has been really, really useful. So I want to say thank you for that. I'll just share my screen. There we go. This is where you see all my secrets. So yeah, I'm going to see my secrets.
If you want next week's agenda to stakeholder council, there it is.
Yeah, that's going to change. Okay, so I'll just give there you go. So I guess just to give a bit of a background then. So long-term plan was published just over a year ago, sort of last January, nearly 18 months ago now. We, within that, there have been many sort of commitments to children and young people. We'd spent sort of the last year, I guess, sort of in sort of setup mode, creating some of our governance, getting our stakeholders together, etc., etc. But really, we felt that April was going to be the sort of the launch pad for us in terms of having sort of a central team in NHS England to lead work for children and young people, to bring in the other big programs that we work with, including sort of Lorraine's work, but also the mental health team, work we're doing around learning disabilities and autism, and then a sort of portfolio of work for us to manage within my team centrally across some of the sort of the big cross-cutting themes, such as transition to adulthood, integrated care, and how we really get CYP on the agenda for local integrated care systems, and work on deterioration and spotting, where we spot a deterioration in children and young people across the system, as well as others. So we were sort of gearing up for that. And I guess COVID's come along, which has been, obviously an issue in terms of us as sort of our setting up as a programme. Luckily, we do have more resource than we had last year because we've been able to recruit some national posts. So that's been really helpful. And I think that's helped us with being able to get into some of the conversations at national level anyway, that sort of Lorraine mentioned. I mean, I'm sure there's more we can do, but I think we have worked really, really closely with Royal College of Paediatrics and Child Health, PHE, DFE, and I guess we've used whereas we've had to sort of pause our transformation activities while the NHS is focused on COVID, we have kept almost the sort of the programme going in terms of a board to bring together the NHS SROs within NHS England, but also DHSC, DFE, colleagues from Public Health England, NHSX, etc. And we've used that as a way of, within, maybe not working as a classic programme board, but working as a way of getting the national partners together to sort of say, okay, what are sort of the key areas? And I guess in the meantime of, having sort of paused the programme, one of the key things we just got out before COVID came upon us was to sort of, an expression of interest document that we'd sent out to sort of to get local systems to think about children and young people, and to say who wanted to be almost our sort of early adopters and pace setters for local systems that really could put children at the heart of what they're doing. But that's been paused, and I'll come back to that at the end. But there's been a number of issues, I think, that my team and my sort of clinical colleagues that I work with, so Simon Kenny is our new National Clinical Director for Children and Young People, that have been involved with, and this is just a selection of them to sort of give the range, I guess, of what we've been involved in. So at the very early days, there was lots of discussions about paediatric critical care capacity, how that capacity was flexed so we could manage COVID. But absolutely, I mean, our team was there to say, well, hang on, that's fine, but we need to make sure we protect these beds and the provision of care for children and young people. And regions worked really hard to make sure that there was flex for adults, but actually there was, always going to be sort of capacity for children and young people. Delayed presentations, that was sort of the next issue that came along quite quickly. So how when you're telling people to stay at home, of course, there's going to be issues of people feeling comfortable to bring children to primary care or even to A&E, and as we all know in this school, children get ill and they get better. A lot of children get better quickly, but others don't. So we did in incredible sort of pace of worked really close with colleagues to sort of change some of the messaging around that, or to look at how we 111 was operating. And we're actually just about finished getting a sort of a piece of work pilot almost, or it's not really a pilot because it's just something we need to do at the moment, but how do we get more paediatric critical paediatricians, workforce and other professionals into 111 so they can give that advice over the phone. Protecting the most vulnerable children. So this, I guess, is from, again, an issue that was brought up very, very quickly with us through, as I said, through Christine and others, of how do we sort of support the most vulnerable, and I'll come on to that again in a moment. We know there's been huge change in terms of the way some of the care has been provided. Some of that's, we would want to, build on that and to sort of test whether that is. I'll come on to that in a minute. So evidence. So again, evidence, I think, has been a real key one for children and young people in that, this is a new virus. I mean, in the early days, everyone was saying, well, it doesn't affect children, which has been sort of proven, I guess, from the data we have now. But in the early days, it was a bit of an evidence vacuum. So we've worked really closely with Royal College Paediatrics and others just to make sure there's a page that the Royal College has that updates every week, just to sort of give the latest evidence and the latest sort of journal reviews that are out there for children and young people. Obviously, there's lots of worries about things like the inflammatory syndrome that was in the news, but very much we've tried to work with our sort of clinical community, just be really clear about the messaging for, that COVID, is a disease that seems to affect children less. There's probably been less agreement on some of the issues around transmission, but very much we want to say to people that the NHS is there for them. If your child is unwell, please use services, don't delay. And then guidance, we've talked a lot about guidance. I think NHS England is very much now, in normal sort of circumstances, it's NICE that produces clinical guidance and Royal Colleges that produce clinical guidance. I think we're going to move sort of, now that we're out of the sort of the first phase of COVID, I think that's going to become the case. So hopefully there'll be less guidance from us. So in terms of what we're doing over the next 6-12 months. So I guess in the space of not, doing what we thought we were doing for the long-term plan, these are sort of the 5 headings, I guess, of the work that we've been doing nationally, and that we want to consider how we sort of do more on over the next sort of for the rest of the financial year, I guess. And there's lots of conversations going on in the NHS around sort of capacity and how we balance the response to COVID with some of these wider things. So our ask was almost, okay, what are the things that are going to support the response to COVID? What are the things that are, do you want to sort of, if we are pausing some things, what are the things actually you don't want to pause, or what are the things you actually want to bring forward? So absolutely, all of that has been in the context of getting services back to where they were. That's going to be a huge challenge for our elective operations, but we know it's going to be, we know that we need to have, services there for, Lorraine talked about the community service document, there's huge amounts of work going into that to sort of get to where we want to be with that, and across mental health as well. So I guess all we're doing, we need to think about the context of how to get services there, and also to get the confidence in families, carers, children, young people to actually use those services. Virtual by default, so I winced a bit at that one because my first point is, well, not all services should be virtual, but I guess we know that that's where the push has been with services. So we want to consider what can we learn from that? What does work? What is going to importantly support our integration agenda, both in terms of giving families, young people, children, carers, a better service, but also break down the barriers that we have across different sectors. So how can virtual be the way to do that? And then really important, what are the services that it doesn't work for, or could be dangerous, or etc. etc. So there's a lot of the NHS England's focus at the moment is there's the sort of restoration piece, but also the sort of innovation piece. So a letter went out from Steve Powis a few weeks back, sort of to our clinical community, just saying, what are the innovations that we want to look more at and to get more evidence on and gather. And again, I think for me as a programme team, once the sort of the comeback from that letter's come, we're going to have to do quite a lot of work to consider what are the innovations, how do we get better evidence, how do we get more experts to look into that, and see how we actually make it happen. So spotting deterioration. So again, I've mentioned that. So we're doing a piece of work with 111. We're also considering, based on some of the delayed presentation work, how could we speed up some of the work that we're doing on creating a sort of a unified paediatric early warning system that could be used. We were piloting that in the sort of inpatient settings. We want to consider actually, how do you get that into the community? How can we work with primary care? Because these are where the sort of tragic cases of harm and happen. So we want to bring that forward. Vulnerability, which I'll talk to more in a moment, got some more slides, and then data and information. So I know this is a bugbear for many people for a long time. How do we join up the data and evidence information across the NHS, local authorities, education? Because if we don't do that, how do we know what works? How do we know where outcomes are slipping? How do we have the cause and effect of what processes and what interventions are the ones that we need to back? So and getting that intelligence. So that's something that we want to do as a program anyway. I think COVID has again highlighted the need to do that, and also I guess loosen some of the restrictions in terms of data sharing. So that's something that we're sort of beavering in the background on to try and think about how we break down those barriers around data. I've only got 2 more slides, Christine, so don't worry. So this is a slide deck. So as I said, we've kept our CYP transformation program board running during COVID, and one of the themes that came up immediately was almost the term vulnerable. The way the term vulnerable is being used in lots of different situations around, it has been sort of overtaken in terms of use by being the reference in terms of what we mean by shielding. But actually, the issues that were being brought to us are around vulnerability for those for those children, young people, families that we, colleagues on the line work with all the time. So this is an attempt, and this is where, as sort of sitting at the umbrella at the top of children and young people in NHS, where we've really had to work with Christine, Lorraine, all sorts of colleagues to get these words into a place that was sort of acceptable for everyone, because it's I don't think it's been done before, and it was quite a tricky exercise to get where we've got to. And I'm sure people on the call will have thoughts on the language potentially, but this is where we got to, I guess, just so we can be really clear when we're talking about what needs to be done for children and young people, what we mean by the clinically vulnerable. So shielding, but not just shielding, but also those that may have a clinical need based on the sort of non-COVID effects and the effects of delayed presentations, etc. What we are doing for those with education and health and care plans. So I guess this is the one for colleagues on the call. But this was always quite a tricky one actually to come up with the right title. So we called this one higher risk and statutory entitlement for care and support. And then the final one, so those that are higher risk due to family and social circumstances. So here more the wider determinants of health, conflicts with the family. So I think we've got general agreement nationally anyway from people that these are the right sort of headings if we were going to talk about vulnerability. And I guess the next question is hopefully that's helpful. I hope that's helpful just doing this exercise. It'd be good to get colleagues' thoughts on that. I guess the next question is the so what question, and how is this then turned into something that's tangible or something that can be used by a local area or used to actually understand what needs to happen for the groups of children, young people, families within these settings, and how do we support local areas in their planning to make sure they're doing the right thing. So that's the sort of the next step to this now. We're thinking about what we actually do with this. We work, as I said, we work really closely with colleagues at PHE and across the system to sort of come up with these. So the next thing is almost like, do we use this to create a risk profiling tool? What's the data that sits behind it, etc., etc. So I think it would almost be what will guide some of our work going forward in the vulnerability piece. And this is just a slide just to put the sort of scale on the numbers within each of those groups. Again, just to sort of get it into the minds of policymakers in terms of, sorry, you see my wife walking past me in the background. You've got 200 people on the call. So this is just to give people, again, just to give policymakers who sort of maybe sit across all of these things or aren't expert in all of these things, just a scale of what we're talking about here in terms of children and young people. And very much, again, I know the shielding announcement came yesterday. I think there'll be more to follow on that, especially in terms of how we implement it. But very much, that's been sort of guided by some really, I must say, some really good work by the Royal College of Paediatrics and Child Health. If anyone's interested, there's a guidance document they published a couple of weeks ago that it's a clinical document. It's not policy. It's a clinical document, but I think it's a very sensible document in terms of who should shield and who shouldn't. And I'm sure that's something that the CMO and others took into account with the announcement yesterday. So just very finally going forward, so these are things that we are beavering away on sort of nationally. And what I should also say, as I always have to do with this, with presentation of this, working closely with colleagues, so Lorraine, mental health, learning disabilities, screening and immunisations teams, trying to pull that together through some of our governance for the board, which we're doing. I guess we're still in discussions around how do we get this through to local systems? How do we put, as sort of Lorraine said in her slides, how do we get children and young people there? We would have been using the long-term plan to do that if we didn't have COVID. Now that COVID's sort of here, I mean, it isn't just about us pushing. There's also quite a lot of pull. So I think what's interesting when you work on a area which is a population group, normally we work around documents, don't we, or strategy documents. So 5-year forward view for the NHS didn't have much mentions of children and young people, so there wasn't wasn't as much activity as I know some people would have liked. Long-term plan had a lot of mentions, so then you get myself being given more resource and a team to set up the governance for this. I think when you have a national crisis, well, actually all that sort of goes out the window, and you say it's really, of course, there's huge issues for children and young people in terms of the response to COVID, but also all of the things that have been mentioned already on the call. So it's just about how we sort of formalise that, I guess, in the next 6 months, working with our regional colleagues. I'm speaking to a lot of our regional leads tonight, actually. And absolutely, I think Lorraine and I always plan that one of the roles of the new CYP programme was to try and bring all these things together. So to bring, the SEND leads together, to bring the sort of disparate work that's going over here on diabetes or asthma or whatever it may be. And I think at regional, we can do that at national level, but the real improvements will come if we can get into a good space where we can do that at regional level and local level. And that's still our ambition. It's just working through what's happening with COVID at the moment.
Okay. Thank you very much, Richard. That's great. It's been interesting watching the chat. I think that there is a general agreement with your vulnerabilities work. You know that I'm a big fan of it. Now I got my own way on the words. But that also it's been a really step forward. Obviously, there are a lot of people who don't like the word vulnerable, but this is very much about giving the system a common language and trying to take that forward. I think the other thing that's coming through on the chat, which is not yours, Richard, but a real reflection of the sort of impact of the pandemic, has been the whole stuff about the digital divide. Yeah. So actually, technology is great if you've got it. It's not much if you haven't. And I think what's been really interesting for me in the last few weeks as we've been involved with this and other things is actually how focused the whole both economic and racial divide has also become. So, we have to be really, really careful in all of our services that we are providing support in ways that reach all of our communities. And I think that the pandemic has really shown where those challenges are. And then there's a really useful comment from Ruth, which is about linking. You see, I like that re-stratification work, and linking that to the work that we're trying to develop in relation to dynamic support registers or dynamic support systems, or wherever we're calling them. So that development of that national idea, which I know your team and others have worked really hard on, into, as you say, how that reflects into local delivery. Yeah.
Yeah, and I think you're right. There's so many issues, aren't there? If you take for children, the one that worries me is around education, and the fact that at the moment people are going to want to catch up at some point, and we know who will be able to get their would I be able to allow my children to catch up compared to someone else? That is really, really challenging. So I'm trying to make sure that on the NHS side we're really cognizant of the wider issues, because they will lead to health issues in the longer run. We know that.
Indeed. No, thank you for that, Richard. We're going to come back to you afterwards. I think people have been absorbing what you've had to say, and also people are really keen as well that that your slides will provide a really good background. So when they're ready to come round, we will make sure that they get them. And for those of you interested in the development of dynamic support registers, there's a lot of work going on, and I think the real challenge for Richard's team, as he's explained, and as all sorts of us nag him on generally, is actually how we hold all of these different work streams going together. And if you are interested in risk registers in Catherine Brown's workshop, you can have a look at that, and we will send information out in a bit. Right, I'm going to thank you and let you go, Richard, because we are going to move on. But thank you very much indeed.
Thanks so much. Thanks, everyone.
I was about to say, Nick, you have appeared miraculously on my screen, which is brilliant timing. Nick, you're going to give us an update on Ofsted. And it says we might have Lee as well. But anyway, we are going to ask you, Nick, about what's going on, and if you can also pick up anything that your teams are doing with local areas and what they might expect at the moment, that would be really, really helpful.
That's great, Christine, thank you. Afternoon, everyone. Christine, apologies, you only have 50% of this particular partnership. Lee's not with us today, but my name's Nick Whittaker. I'm one of Her Majesty's inspectors, and I'm Ofsted Specialist Advisor for SEN and Disability. And I'm just going to give you a brief update on matters relating to our programme of area send inspections, and hopefully there'll be an opportunity for questions as well. I guess, as you already know, our programme of area send inspection is paused currently. No full inspections, no revisits, and we stopped inspecting at the beginning of the pandemic. Immediately prior to COVID-19, we were almost at the end of the 4th year of what is a 5-year programme of inspecting area send in all 151 areas in England. We'd inspected 117 areas up to that point, with 34 area inspections remaining in the programme. At that time, we also paused the publication of our reports from inspections and revisits, and we're now beginning to publish reports. So initially, although we'd paused publication, we were taking reports through Ofsted and CQC's quality assurance processes, where leaders in local areas were able to complete factual accuracy checks. We were then taking those reports through to finalised versions and sending them to local authority and CCG leaders, and we've been beginning to publish those reports on our website and on CQC, on the CQC website in the last couple of weeks. As I'm sure you also know, the requirement for areas to produce and submit written statements of action, where inspectors had identified significant areas of weakness at a full inspection. There has been a temporary modification to the 70-day requirement for those plans to be submitted to HMCI, and requirement that those are submitted within a timescale that is reasonably practicable. And I think where that flexibility has worked really well is where leaders in areas have worked closely with colleagues in Ofsted regions, with Department for Education and NHS England advisors, and there's been a strong sense of the momentum behind that important planning being gained. Everyone's confident in those plans and the plans, but pragmatically, there's been the necessary level of flexibility as well. Inspection will inspection will restart, and it'll restart when it's right for it to restart. And I think if you look at the purposes of area send inspection as they're set out in the framework, not in the handbook, it talks about these inspections holding leaders in areas to account individually and collectively, but it also talks about the importance of inspection promoting improvement. They're the broad purposes and aims of the programme. And clearly, without our inspections being able to produce valid, reliable findings, it's not possible to achieve either of those purposes, is it? So practically, we're working with a range of stakeholders to think about when and how our programme of inspection will restart. And we've got representation from CCGs, from the DCO, DMO network, but also we're giving careful thought to how we can best support improvement in areas in the interim period before you restart inspection. Alongside all of those things, and you'll know for some time now, we've also been thinking about the future of the area send inspection programme, and again, work that has had and will continue to have significant input from different stakeholders. And there are several things that we are already thinking about and working on in order to plan for area send beyond the end of the current inspection programme. So I guess some key things are, what have we learned about the send system from the current programme of inspections? What have we learned about the approach that we've taken to inspecting send arrangements in areas? And we've recently finished an evaluation of that. The fieldwork's completed, and we'll be publishing the findings and recommendations from that in the coming weeks. We've also been thinking about and are continuing to think about, so what are the things that make the biggest difference to children, young people and families' experience and the outcomes they achieve? And there's a lot to be learned from wider research, from the professional consensus, but for us the most important dimension of that is, what do children, young people and families themselves tell us are the things that make the biggest difference? And of course, a key part of thinking and planning for inspection in the future is engaging with those we inspect and regulate across the Ofsted and CQC, and we're right at the beginning of that work as well. Is that a helpful update, Christine?
Yeah. Oops. Yeah, thanks, Nick. That's really helpful. I think it's quite reassuring for people to know that there is still some work going on, and that the momentum for change hasn't been lost in the pandemic. I know also you and your teams with CQC as well have been doing some support to local areas, and I think that's really helpful, because I think that challenge about sort of just seeing the wood for the trees at the moment is really very difficult.
I think so. I mean, as I'm sure you know, about a third of my colleagues in Ofsted are redeployed into various roles, some in other government departments, some in local authorities, some into other roles. I think in relation to SEN and disability, Christine, and I know we've spoken about this before, looking at the very limited amount of research that's available about the impact of epidemics and pandemics, two key bits of learning to me are, firstly, that you absolutely need to know how the disruption caused by things like this impacts specifically on children, young people with SEND, whether that's public health messaging or accessing education, but in that range of different ways. And it also seems to be the case that you need to understand those things in order to understand how to build a system back better in the wake of the pandemic. And I thought that came through really strongly in the previous presentation.
Thank you. Two quick things, Nick, before I let you go. One, you'll be glad to know that we've had something on the chat saying about we've had a great inspector working with us. It's made a real difference, so that's fab. And the second thing is for those areas that were on written statements of action, and we're looking forward, I'm sure, immensely to their revisits. Can you just update us on what's happening to them, please?
So the programme of revisits will restart along with the programme of full inspections. And the decision making about how and when will be done together. And as I've said, we're not working in isolation to make those decisions. We're engaging with a wide group of stakeholders to understand how best to make those decisions in children, young people, families' best interests. But pragmatically, we need to understand. We need to be in a position where we're able to inspect and provide the kind of assurance that parents and carers rely on us providing in a valid and reliable way.
Okay, that's brilliant. Thanks ever so much for your time, Nick. It's really helpful. And now I'm going to come back to Amanda, because you're going to explain the workshops for me, aren't you, Amanda?
Yeah. Just to remind people, you have had 2 invitations to your 2 workshop choices. So you just need to find those in your inbox or in your team's calendars and join them. If for any reason you can't find your invite, then do email Marie and let her know. But hopefully, momentarily, you will be joining a workshop. And please do remember to fill in the evaluation at the end of workshop 2. And thank you all very much again for joining us.
Oh, now what am I meant to be doing something now?